hard or soft, because those can be indicators of various different things. And if I could see it myself, that would be ideal, but he's pretty healthy. And if it's okay, I'm going to start in your right lower quadrant, and I'm going to listen to your vowel sounds. And if I didn't hear anything, 5 minutes in each quadrant, but let's see if I do. Okay, and then just listening for a minute. And I got right lower quadrant, and then coming up, and then here, down, and then basically looking for hyperactive vowel sounds. So maybe more than 20, or 30 per minute, might mean there's a lot going on in there, or less might mean we need to get you up and moving. Everything sounds good, and if it's okay, can I ask you, are you urinating okay? Is there any pain with that?
No pain. Yeah, it's all good. It's normal.
Okay, and since you're a man, I would want to just say, if you would like, I kind of want to assess your urinary system and your genitalia, and if you want a male staff to come in and do that physical part, that's totally fine. Do you mind if I do it, or?
Yeah, I don't mind. Go ahead.
Okay.
Thanks for asking.
So, it looks like I just looked in the toilet and I can see that your urinary output looks good. Its frequency is, 5-6 times a day, and the amount's good, the color's good, and the odor smells fine. There's nothing, totally pungent about it. So I would chart by exception for that too. And then just kind of assessing the area. On your left side, I'm just going to feel underneath your rib cage to see if your lymph node, your spleen is swollen. Is that tender to touch?
No.
Okay. And not under here either. Okay. And I would never palpate a tumor or anything like that, so I visually inspected it, auscultated it, and then now I'm palpating. And then, is there any flank pain in your bladder region? When I put, is it tender?
Nope.
Okay, good. All right. And so everything looks good with that. And then just want to make you comfortable while I just assess the genitalia. Just pull this down. And if I had another towel, I would just pretend that wound is not there. And so with the penis, young patient like this, let's see. So if uncircumcised, I'd pull back the skin, just assess, make sure there's no fungus, everything's clean and hygienic and all that. And then there's no, lesions or growths or anything on here. And then with the testicles, I'm giving a feel for any nodules. Anything uncomfortable down here?
No.
Anything you want to talk about with, are you, everything going okay with sexual function?
Oh, yeah.
Okay, great. All right. And so charting by exception, everything seems to be normal there. And so now I'm going to assess the extremities, carefully moving the stabilized wrist. And your x-rays should be back soon, and the doctor will talk to you about the next step. And I just want to make sure, I know this was kind of a big deal, and you might have to be in a cast, and I'm just checking your mood and your affect to make sure you're okay.
Like I said, I've been worse.
You've been worse. You've had some injuries before?
A couple, yeah.
Okay. And you seem to be okay with everything, so I'm not particularly worried about your psych state. So if it's all right, I just want to check your motor skills in this arm.
Sure.
So can you just go ahead and push against resistance? Okay, good. And then I'm looking at the fingers and hands, no clubbing. And I'm doing a cap refill, and I'm getting less than 2 seconds, which is great. Wiggle your fingers. Awesome. The color is really good. I can check for tinting, so I'll just pinch up the skin and it returns immediately, which is good. And then here we have the brachial artery, so you can palpate and listen here for a pulse as well. Here's the radial, and then bilaterally I'll check over here in this arm as well. For the sake of space, I'm gonna lean over, but normally I come over. And yeah, you got a good cap refill over here. Can you wiggle your fingers in this arm? Okay. And then I'm just very gently gonna palpate here. And I am getting a pulse. and it doesn't appear to be a circulation issue. And your brachial again here, and your skin looks good. Okay, so if it's all right, I would like for you to lean forward, please. And then that way I can listen to your lungs in the back. This is a much better spot for me. Typically actually would start with the back before I went to the front. So that's just a notation. So coming back here, just lean forward. You're just gonna take deep breaths for me. I'm gonna start here in the bronchiovesicular region. Here, here, here. Okay, and then the vesicular region. Okay, no wheezing, which would indicate constriction. And no crackles indicating fluid in the lungs. All right, and then I sometimes like to go right under here, under the axillary point. And once more here. And this is a really good time for me to check the skin. And it doesn't appear to have any pressure ulcers or anything like that. And it looks like there's no redness. And if there was, I'm looking to see that it blanches. And it looks good. And this is a very mobile patient, so I'm not particularly worried about this patient's skin, but always good to check everything out. Lean back for me. Okay. And due to the nature of the injury, I'm not going to have him press against this side. We'll have the doctor do that sort of assessment. Moving down the legs, I'm going to pull this back, if that's okay. And I'm looking at the skin color. We got the popliteal right here, and I'm picking up some pulses here. Great. All right. And can you move your legs for me? Good. And can you wiggle your toes? Awesome. And then go ahead and press here. I can assess for DVT with the Homan sign. Are you feeling any pain back here when I do this?
No, no pain back there.
Okay. How about here?
Nope.
Okay, great. So no signs of DVT here. I've got the dorsalis pedis. I can pick up a pulse here. And this is also the feet are a great spot to see how the patient's picking up fluid retention, etc. And it doesn't appear to have any pitting or swelling in the legs. And if there was pitting and it was pretty bad, I would time it so I could scale it. But you look really healthy. And the posterior tibialis is back here, another good pulse point, and that's good. And then I'm looking at your toes, good hygiene, no sores on here, no history of diabetes. And I'm getting a good cap refill here as well. Okay, and what?
Go ahead and
oh, yeah. I just want to make sure not. Okay, so I'll cover that up. And then I just want to ask you, is there anything that I can get for you? Everything looks good. You know, if this patient was bed-bound, I would definitely want to do a skin assessment of the buttocks, but since he's a bike rider and all that, I think it would be all right if I didn't look at all of that. If I were to look at his anal region, I would want to make sure there's no redness or itching or discomfort down there. There's no hemorrhoids or bulging, anything like that. But you're okay there, right? Okay, cool. So I'll cover this up. And the warmth is good on this hand, so I feel okay about it till the doctor comes in. And you're comfortable? Is your pain still about a 3 or a 4, or has it gone down even more?
It's still right at a 3, I'd say. It's just you know, mild.
Okay, do you have any questions for me?
No, thank you very much for your head-to-toe assessment on me.
Oh, you bet. And here's the call light, and everything's working, and I'm just going to lower the bed.
And you check for these things for a few seconds. 1, 2, 3. You don't have to put it there.
And so Mr. Hunt, I'm going to be back in about 30 minutes to check on you, okay?
Okay, great.
All right, thanks so much. I'm going to go outside and I'm going to chart all my vital signs and charting by exception and putting everything in the system. And basically, the main things I would want to just put a note on is that I did check for the injury. There's no head injury, and the hand sensory circulation and motor is good. So I feel good about that. And the pain has gone down, which means we reached our therapeutic goal. Okay, I'm gonna wash my hands and I'll see you in 30 minutes, Mr. Hunt. Thank you so much.
Okay, bye-bye.
Bye.